Today we are going to discuss the scapular region. Scapular region has these six muscles: the deltoid, teres major, teres minor, supraspinatus, infraspinatus, and subscapularis. These four are the muscles, also called the rotator cuff muscles. They form a muscular tendinous cuff surrounding the shoulder joint, and it supports the shoulder joint, and it is deficient only on the anteroinferior side. Hence, the dislocations of the shoulder are more common here. So the six muscles have let's discuss them one by one. Deltoid is a muscle which has its attachment from starting from the lateral third of clavicle, then going back to the acromion of the scapula, and then continuing on the spine of the scapula. And it is inserted on the deltoid tuberosity. It is supplied by the axillary nerve root value C5-6. It has three types of fibers. One is the acromial fiber, one is the anterior fiber, and one is the posterior fiber. So the acromial fibers, they abduct the arm up to the level of 90 degrees. The anterior fibers flex and medially rotate the arm, and the posterior fibers extend and laterally rotate the arm. Then coming to the supraspinatus muscle, it is attached to the supraspinous fossa of scapula and goes to the upper part of greater tuberosity of the humerus. It is supplied by suprascapular nerve, and it abducts the arm and stabilizes the shoulder joint. Then is infraspinatus muscle, starting from infraspinous fossa and then going to the greater tuberosity of humerus. It is supplied by the suprascapular nerve, and it laterally rotates the arm and stabilizes the shoulder joint. Then is teres major muscle. It is attached to the lower third of the lateral border of scapula. Then it goes to the medial lip of the bicipital groove or the intertubercular groove. And then it is supplied by lower subscapular nerve, and it medially rotates and adducts the arm and stabilizes shoulder joint. Then is the teres minor muscle that is attached on the upper two-thirds of lateral border of scapula, goes to the greater tuberosity of humerus along with the supraspinatus and infraspinatus, supplied by axillary nerve just like deltoid, and it laterally rotates the arm and stabilizes the shoulder joint. The last one is subscapularis, starting from subscapular fossa and going to the lesser tuberosity of humerus. It is also supplied by the subscapular nerve, and it medially rotates the arm and stabilizes the shoulder joint. Here we can see various parts of the deltoid muscle. It is a large fan-shaped muscle that is covering the contour of making the contour of the shoulder. If this muscle is paralyzed, the contour of the shoulder, rounded contour of the shoulder is lost, and the humeral head becomes prominent. How we can test this muscle, the deltoid muscle? We place our hand on top of the deltoid muscle and ask the patient to abduct the arm. We will see that this muscle gets tensed. In this picture, we can see the muscles of the scapular region. Here the supraspinatus, infraspinatus, teres minor, teres major, subscapularis. Deltoid is removed here. The four rotator cuff muscles, also called the fantastic four muscles, are the supraspinatus, infraspinatus, teres minor, and the subscapularis. In this picture, we can see that their attachments, one of their attachments, the subscapularis on lesser tubercle, the supraspinatus, infraspinatus, and teres minor on the greater tubercle. This is teres major. In this picture, we can see how it helps in the movement. In this picture again, we can see the attachment of the supraspinatus muscle, the rotator cuff muscles, the sits muscles, and here we can see that how they are covering the shoulder joint. Now we will discuss the intermuscular spaces of the scapular region. We have three intermuscular spaces. One is the quadrangular space, one is the upper triangular space, and one is the lower triangular space. Now I'll tell you the easiest way to remember these things. In this picture, we can see the intermuscular spaces of the right side. Take your right hand, take out your index finger and the middle finger and put them vertically like this. And then take your left hand and put your index finger and middle finger horizontally. So in this way, we are able to create the three spaces. Now this one is the humerus on the lateral side and triceps on the medial side. This is teres minor superiorly and this is teres major inferiorly. In this way, we are going to learn the boundaries of the intermuscular spaces. First of all, let's do this from this picture. Quadrangular space has its lateral boundary formed by humerus, medial boundary formed by triceps, superior boundary formed by teres minor, and inferior boundary formed by teres major. Coming to the upper triangular space, the superior boundary is formed by teres minor, the inferior boundary is formed by teres major, and the lateral boundary is formed by triceps. Coming to the lower triangular space, the superior boundary is formed by teres major, medial boundary is formed by triceps, and the lateral boundary is formed by humerus. Now this is on ground how these muscular spaces are formed. This is lower triangular space, this is upper triangular space, and this is quadrangular space. In this picture we can see the boundaries once again. Quadrangular space has superior boundary by teres minor and inferior boundary by teres major. Lateral boundary by humerus and medial boundary by triceps. Two structures pass through the quadrangular space. One is the axillary nerve and the other is the posterior circumflex humeral artery. Now coming to the upper triangular space, superior boundary is formed by teres minor and inferior boundary is formed by teres major and the lateral boundary is formed by triceps. Circumflex scapular artery passes through it. Now coming to the lower triangular space, the medial boundary is formed by triceps, lateral boundary is formed by humerus, and the superior boundary is formed by teres major. And the structures passing through it are the radial nerve and the profunda brachii artery. In this picture, we can again see the right-sided intermuscular spaces. This one is the quadrangular space, this is the upper triangular space, and this is the lower triangular space. The various contents of the triangular spaces I have mentioned earlier. The quadrangular has axillary nerve and posterior circumflex humeral artery. Lower triangular has profunda brachii vessels and the radial nerve. And the upper triangular has circumflex scapular artery. Now I am going to briefly discuss the anastomosis around the scapula. Anastomosis around the scapula is formed at two levels on the scapula. One is on the body of the scapula and one is on the acromion process. What is basically anastomosis? Anastomosis is a communication between branches of two major vessels. In this case, it is the subclavian artery and the axillary artery. Branches of subclavian anastomose with branches of axillary to form these anastomosis. And what is the function of the anastomosis? If there is blockage at the lower end of subclavian or upper end of axillary artery, it can be bypassed through the collateral circulation, that is through the anastomotic channels. So we are going to discuss them one by one. First of all, the anastomosis on the body of the scapula. So this is the subclavian artery going down and out at the level of outer border of first rib. It continues as the axillary artery. The subclavian artery gives off a thyrocervical trunk, which further gives off a transverse cervical artery and a suprascapular artery. So this first, we are talking about the anastomosis around the body of the scapula. This anastomosis is between the transverse cervical artery from subclavian, suprascapular artery from subclavian, and circumflex scapular artery from the third part of axillary artery. This anastomosis between the subclavian and third part of axillary is called the anastomotic channel at the level of body of scapula. The next anastomosis is the anastomosis around the acromion process. So an acromion branch from the suprascapular artery, this thin one, acromial branch of the thoracoacromial artery, this one here, and acromial branch of the posterior circumflex humeral artery. They take part in formation of this anastomotic channel at the level of acromion or acromion process of scapula. So I'll repeat. This anastomosis is basically between branches of subclavian and axillary arteries. The anastomosis at the level of body of scapula is made by the transverse cervical of subclavian, the suprascapular of subclavian, and the circumflex scapular of axillary here. And the other anastomosis at the level of acromion process is acromion branch of suprascapular, acromial branch of thoracoacromial artery, and the acromial branch of posterior circumflex humeral artery. This is the second anastomosis at the level of acromion process. In this picture, we can again see the anastomosis at the level of body of scapula and the anastomosis at the level of acromion process. Now, how can we test trapezius? Trapezius is the shrugging muscle. We put our hand at the level of trapezius muscle and ask the patient to shrug. And in this way, we can see the integrity of the trapezius muscle. These are the various movements of scapula, which are the elevation, depression, adduction, abduction, upward rotation, and downward rotation. That's all for today. Thank you.